This one is an interesting one about folic acid. Do you know why we recommend taking folic acid prior to getting pregnant and at least through the first several months of pregnancy? Chat, do you know anything about folate or folic acid? Neural tube defects, yep. So it decreases the incidence of neural tube defects. And neural tube defects are things like spina bifida or myelomeningocele, things like that, which is basically when the neural tube is forming and it doesn't come together correctly or form all the way. And it can be a range of defects that ranges anywhere from not that big of a deal all the way up to completely life-limiting and disabling. So the reason we recommend it before pregnancy is because you need your folic acid levels in your blood have built up to a level enough to prevent the neural tube defect, and it happens very early in the embryologic process. How early do you generally recommend patients start taking prenatals before trying to conceive? Usually a few months is what you're going to want with the folic acid, to start taking them a few months before you try to conceive. Now, obviously, if you weren't planning to get pregnant, then that's, a hard thing to do. But, I think that it's probably reasonable for everyone to just, if you're having sex with someone who can get you pregnant, and a pregnancy, even if unintended, would be something that you would keep, then it probably makes sense to go ahead and be on a vitamin that has folic acid in it anyway.
If you are pregnant, you can take folic acid to help prevent certain birth defects in your baby. Folic acid and folate are two forms of the same B vitamin. Folate is the form that occurs naturally in foods, while folic acid is the man-made form added to multivitamins and fortified foods. Your body needs folic acid to help make new cells, including brain cells, blood cells, and DNA and RNA, the genetic material inside your cells. During pregnancy, you need even more folic acid.
So this is a embryo forming probably, 5 weeks-ish.
Because your baby's body needs it too. Folic acid helps your baby's brain and spinal cord develop normally. Taking folic acid can significantly reduce the risk of neural tube defects in your developing baby, called an embryo at this stage. The neural tube begins as a tiny oval-shaped piece of embryonic tissue, which folds into a tube about 28 days after conception.
So 28 days after conception, that's 6 weeks in the way that we would document pregnancy from a last menstrual period or 2 weeks prior to conception. So that's always important when you're watching these, because sometimes they will say certain amounts of weeks when you're learning about this stuff, and you don't know if they're referring to what is an embryonic or conception age, which is 28 days after conception, or they're referring to a gestational age, which is 2 weeks before conception, and it's confusing. So you always have to pay attention to that. 28 days after conception is going to be right around 6 weeks of pregnancy. And yeah, that's right. And 4 weeks after the ovulation that happened.
When this tube closes properly, it
Also, this is very confusing. Embryology is a very difficult and confusing topic to understand, and it still sometimes breaks my brain, but I remember it being a very challenging topic in medical school, partly because I don't think we had a very good embryology teacher, but also it's really complex, and you have to imagine it all, right? So you can't now that we have great animations and stuff and the pictures are fine, but I couldn't always get the 3D understanding in my head, because you don't really get that from pictures, and it's not something you can observe happening in real life. So sometimes it's very confusing to try to understand.
Continues to develop into your baby's brain and spinal cord. If the neural tube does not close due to the lack of folic acid in your diet, your baby may have a neural tube defect, such as spina bifida or anencephaly. In spina bifida, the neural tube fails to close at the bottom. As a result, the parts of the spine that enclose and protect the lower spinal cord do not completely form, allowing the cord to protrude. Children with this defect often require surgery and have permanent disabilities, including.
So they're going to talk a little bit about the results after birth. The way that this is fixed, it ranges. It depends how severe it is and when it's diagnosed. How do we diagnose it? You can sometimes diagnose this based on a blood level called AFP. Now, you wouldn't diagnose it for sure. You'd want to also look on ultrasound, but that can be a screening method for seeing, the AFP or alpha fetoprotein level is too high. And that can sometimes indicate that there could be some kind of open neural tube defect going on. That level is generally going to be drawn, I think, around 12 weeks. And you can also do a nuchal translucency scan at that same time, which can give you a hint by ultrasound if there's something going on. However, by and large, most of these are not diagnosed until the 18 to 20 week scan, because that's the time where the fetus is finally big enough that you could actually see this. If you imagine, a fetus is this small, you're going through all of the layers of the body to see it. Just to look at a tiny place in the bottom of the back, or later on they'll talk about upper neural tube defects, then you're looking at something very tiny, and it can be difficult to diagnose really early, but sometimes we can diagnose it really early. You can have a fetal surgery for this. Very, very fascinating process of doing a surgery, either laparoscopically, minimally invasive through like keyhole incisions and repairing it during the pregnancy, or even an open fetal surgery where they make an incision on the abdomen and then on the uterus. They open up the uterus and bring the fetal back up to the top of the uterus and repair it that way. So it's very interesting. Fetal surgery is a fascinating thing. It is dangerous, and so it's only done in certain situations for particular problems where you can fix it in a way that decreases the chances of a long-term disability, but again, comes with a not insignificant risk of extremely preterm delivery and miscarriage.
Leg paralysis, developmental delays, and nervous system problems. In the condition called anencephaly, the neural tube fails to close at the top, preventing large parts of the brain and skull from developing completely. Babies with this defect are unable to live and usually die before birth or soon after.
So these babies are, if you've seen my video on YouTube with my mom in it, she's a labor and delivery nurse, and she talks a little bit about a baby that was born with anencephaly, that she took care of her mother, and her mom had been, I think, in the chat or commented or left anyway. So she talks a little bit about kind of the care of this family after the birth of a baby that had anencephaly. Sometimes these babies do live a while. They have a brain stem. So they have the part of the brain that controls your like autonomic function, which is like breathing and things like that. But everything else is exposed and the brain itself doesn't develop. So it's really devastating, obviously, and it can be very difficult for families to decide what to do, whether they, once this is diagnosed, whether they want to continue the pregnancy and all the way up until term, deliver the baby and do comfort care, or, some families will decide that they would rather terminate the pregnancy and have an abortion. And that's a very hard decision. This is where I think abortion laws are, they always, I think people don't understand how significantly you impact people who have things like this when you are passing these blanket legislations. And it's so heartbreaking, and having taken care of so many families who had this diagnosis and seeing them navigate it and make a choice of what they want to do, and the vast differences between the way that people kind of process this and make their decisions. I think it's awful that there are many, many, many people living in many, many, many states who don't even have the option to make that choice anymore if their baby's diagnosed with this.
Folic acid may also protect against other birth defects, such as cleft lip and palate, and atrial septal defect, which is when a hole between the right and left upper chambers of the heart fails to close during development. Because the neural tube develops so early in...
Okay, so this is a good question and something that feeds on this a little bit. So, okay, I'm totally freaked out right now. I'm currently 10 weeks pregnant and I missed my prenatal that has folic acid for 2 days. Should I be worried? No, I mean, the thing is one, this is much more important prior to pregnancy, and also neural tube defects can happen with or without folic acid supplementation. It is not 100% going to prevent it, and most babies born even without having been in an environment that was supplemented are still going to not have a neural tube defect. So I don't ever want people to think like, oh, I caused my baby's neural tube defect because I didn't take folate. That's silly. You don't cause these things to happen, right? This is just, it's a thing that happens. And we know that supplementation with folic acid decreases the incident, decreases the risk, but not to zero. And so we don't even know in situations when baby is diagnosed if taking that would actually even have prevented it. All we know is like risk and benefit, right? So Dharma's family, the family I was just talking about earlier that my mom talked about in the YouTube video that she was in with me, they actually had a second baby, I think, that had the same diagnosis. And they were using high dose supplementation. So normal supplementation in the first pregnancy. People who've had this diagnosis in a previous pregnancy are given higher doses prior to and during the next pregnancy. And it happened again. And that's incredibly, incredibly rare. So we don't know everything there is to know about preventing this.
In pregnancy, often before a woman knows she's pregnant, experts recommend all women who are able to become pregnant take a daily multivitamin containing 400 micrograms of folic acid every day.
Also, at 10 weeks, the neural tube is already closed. So we talked about it being 28 days after conception, which is around 6 weeks. So this happens very early in the pregnancy, often before people even know they're pregnant a lot of times. So here in New Zealand, we don't keep people on folic acid through the whole pregnancy. Most of the time, we stop it after the first trimester.
During pregnancy, the need increases to 600 micrograms of folic acid each day. Experts recommend you take this multivitamin in addition to the food folate in your diet because your body does not absorb folate found naturally in food as easily as the man-made folic acid. Caregivers will often prescribe even 1,000 micrograms of folic acid daily to assure these minimal levels are covered. Even more may be required in some groups of women, including those with previous miscarriages and those women deficient in a folic acid metabolic enzyme. Talk with your caregiver about the optimal dose for you.
So, very interesting. So they talked about a 400 micrograms is the recommended supplement amount. And for people who've had a history of this happening in the past, you're going to increase that by a lot. So I think it's up to 4,000 micrograms. Let me look and make sure. I honestly have not had to counsel anyone on this recently. All right, here's the recurrence risk that we were talking about. So isolated neural tube defects, 2 to 4% with one affected sibling. So if you have had a pregnancy with a neural tube defect in the past, 2 to 4% of future pregnancies will be the next risk in the next pregnancy. Risk according to family history. Risk of recurrence appears to be higher in countries such as Ireland, where the occurrence of neural tube defects is high. Recurrence is likely related to multifactorial inheritance pattern, including genetic and environmental risk factors. Recurrence risk for anencephaly is 2 to 5%. And then there's some other kind of genetic conditions that are related. Supplementing with folic acid is safe and effective for prevention. And talking about here, oops. Yep, so people who have had a prior pregnancy diagnosed with a neural tube defect should be given higher doses, 1 to 4 milligrams daily, starting 3 months prior to conception and maintained through the first 12 weeks, after which a reduction is recommended down to 400 micrograms. So 1 to 4 milligrams daily, and I assume that that's going to vary, that recommendation, depending on where you look and what the risk factors are. Let's see. Yeah, so ACOG recommends 4 milligrams for anybody who's had a open neural tube defect in the past and a family history. Okay, so increased dose for, I don't know what SOGC is. Hang on. Oh, that's Canadian recommendation. Okay, so ACOG and Canadian, American College of OBGYN and Canadian OBGYN College recommend 4 milligrams daily or 4,000 micrograms for anybody who has had a first-degree relative, like a parent or themselves or a sibling who's had an open neural tube defect, or if they have had a previous pregnancy with a neural tube defect. Hang on. Open neural tube defect, any first-degree relative of either parent or personal history of open neural tube defect in either parent. So this is, you've had it or your parent has, but then it says family history, first or second degree relative here, and it's a different recommendation, so that's a bit confusing. But personal family history of folate sensitive congenital anomaly other than a neural tube defect. Type 1 or 2 diabetes, recommend 1 milligram from the Canadian OB/GYN Society and normal 400 micrograms from the American Society. Gastrointestinal malabsorption and other high-risk conditions, and all of these are really this Canadian recommendations. Pregnancy or potential for pregnancy. This is basically saying anybody who has the potential to get pregnant should be on folic acid during their preconception period. And the recommendation from this is why everybody is always so confused about everything. So if you ever find yourself going like, well, my doctor didn't recommend it to me like that. Well, here's the reason, okay? So do you see all of these different recommendations based on where you look? And they're all based on science, and it's just different interpretations of the risk and benefit. So this is why I'm always encouraging people, like, one, at least I don't, and I don't think anybody should care if you get a second opinion, but two, getting a second opinion or hearing something different from me than your doctor told you doesn't necessarily mean your doctor is doing something wild or the first person that gave you an opinion was doing something wild. Like, recommendations are all over the place for a whole bunch of different conditions and treatments. This is written in a very confusing way. I'm having trouble understanding like who they are referring to in like open neural tube defect of any first degree relative of either parent. Of either parent. So is this the person who's pregnant? So if this is talking about me, is it if either of my parents or any of their first degree relatives had an open neural tube defect? Or is it referencing the fetus? I'm so confused because you should be starting it prior to getting pregnant. And this is the most confusing clinical guideline writing I have ever seen. Somebody should have reviewed this and told them, listen, you need to be more clear on who you're referencing. Anyway, I guess it doesn't really matter because here's how we actually do it. All right. If you've never had a neural tube defect and you don't have any high risk conditions for that, and you've never had a pregnancy with a fetus affected by a neural tube defect, then you should take 400 micrograms of folic acid at least a month, but preferably 3 months prior to getting pregnant. If you have previously had a pregnancy affected by a neural tube defect, or you yourself or the person you're marrying or anyone in your immediate family has had that, then we should increase you to the high-risk dose. And that would be anywhere from 1 to 4 milligrams daily for at least 3 months prior to getting pregnant. And then dosing depends on where you look, but overall the risk of being on high-dose folate is relatively low. Most people, especially those who've been affected by this in the past, if it was severe enough to either warrant surgery or they ended up losing the pregnancy or it was anencephaly or they ended up terminating because it was so severe, almost all of those people are going to say, I just want to give the highest dose, give me the highest chance of preventing this. Meningocele is a neural tube defect, yes.